right, I think we're gonna go ahead and get started.
Sounds good. Hello, everyone. Welcome to February's legislative session updates. Thanks for joining us on your lunch hour. I will just go through the agenda. I'm Erin Riley. I'm the Policy and Outreach Coordinator. Hillarie Hillarie Matlock is our policy director who's going to give us all of the legislative session updates, Medicaid updates, and then the opportunities for action and Q&A today. All participants are muted in listen-only mode. To ask a question, we just suggest click the chat button and type your question into the box to send it to us. There will be a section for Q&A as you saw on our agenda at the end, but feel free to type questions at any time. So Idaho supports Medicaid. If you're new here, just wanted to let you know who we are. We're a statewide network of healthcare advocates, providers, and stakeholders working to keep Medicaid strong for Idahoans to get the care they need, for children to grow and develop, parents to participate in the workforce and provide for their families, and to promote healthy communities. So take it away, Hillarie. Thanks.
All right, let's go ahead and jump in. All right, so I am going to spend the next little bit just basically giving a recap of where we are at in the legislative session so far. So just high level overview, we are in week 6 of the legislative session, and it's going at a little bit of a different pace than we're used to from previous legislative sessions. I remember last year at this point, we had already testified, I think, at a couple of times in House Health and Welfare committees on Medicaid expansion bills. And this year has been a little bit different. Primarily, what we have seen is that the majority of what's happening in the committees as well is really all around rules, RSs, so those bills getting introduced, and budgets are pretty much the headlines to over the last several weeks. However, what's really fascinating is that we are actually on track for more legislation introduced than previous years. So on the Legislative Services webpage online, it's legislature.idaho.gov, you can actually see how many bills have been introduced. At this point in the session, as the end of week 5, which ended last Friday, compared to previous years. And so last year, I want to say, felt like a complete whirlwind of so many bills getting introduced and so many hearings happening. And where I was actually kind of surprised to see we're on track for even more legislation to be introduced than previous years. So I think what's different so far this year is we're seeing a lot of bills in other committees, and we have seen several bills come through House and Senate Health and Welfare, get introduced, but we haven't seen a lot of hearings actually happen quite yet. And so at least on when it comes to Medicaid and healthcare programs. The big headlines really are going to be all around the budgets, and I'll go over what's happening in the budgets in the next couple slides. But what's also interesting is only one bill has been signed so far by the governor, and it is House Bill 559, which is the tax conformity bill. Oops, went too far. Sorry, screen was just slow. So let's talk about House Bill 559. I know that a lot of you who are on our network, get our network updates, see that we have actually came out and encouraged the public to weigh in on House Bill 559. I know that we're a healthcare coalition and network, and we really primarily work to protect access to healthcare programs and Medicaid. And we ended up really starting to get involved in House Bill 559 and tax conformity, largely because of how it has come into the spotlight as being part of the reason why lawmakers have been exploring cuts to so many state agencies, including the Medicaid program. And so this bill, so just for a little bit of history, context, and recap, over the last 5 years, we've had several years of income tax cuts that have been passed by the legislature that has equaled in about $4 billion worth of reductions to our revenue. The state has a constitutional requirement to have a balanced budget. Well, we have decreased revenues, and we have seen a decrease in those revenues beyond what was anticipated by the legislature. And so now we're at this point where we actually have more budgets needed to be covered than revenue available. And so that has gone into session knowing that we were going to have a lot of conversations around budget cuts. Well, then the OB3, also known as the One Big Beautiful Bill, lawmakers love to call it OB3 because nobody seems to like to say One Big Beautiful Bill. And they knew that they wanted to conform to all of the federal tax changes that came from that. Some of it was an extension of current taxes that had happened several years ago, and so it was just a continuation, but there were some new tax changes. And lawmakers, we generally conform to most federal tax changes on an annual basis. And so lawmakers went and said, well, we can't not conform to a lot of these. We usually do. However, they said they wanted to cut Medicaid budgets and education and other programs because they said there was too much uncertainty around tax conformity. And so because they drew that bright line, we came out in opposition of 559 because of the risk it put Medicaid programs at. So unfortunately, the bill passed complete party lines all the way to the governor and was signed into law last Tuesday. It is anticipated the estimated hit to revenue in this fiscal year is about 155 million, and then for and actually I think that is a typo. Apologies. It's actually fiscal year 2027. It's 175 million anticipated for the next fiscal year. And so the estimated cost to implement these changes, so the tax commission came out and said, okay, I see that you have passed the tax conformity bill. However, we need to update our systems because they backdated some of the tax changes to last year of 2025. And so there are system changes that have to happen from the tax conformity bill. And they anticipated that it was going to cost about $500,000 to implement these tax changes. However, no funds were appropriated to give the tax commission what they needed to actually implement these tax changes. We still have yet to see if the legislature will do something about that. So in response to the tax conformity bill that came out, there was a lot of discussion around which numbers do we want to use for how much this is going to cost the state in revenue. Well, there was a lot of different numbers being thrown around. And so they said, well, there's just a lot of uncertainty with revenues being down. We actually think revenues are going to start catching up. And they actually started coming back up again in January. And they said, well, there's just a little uncertainty while we let all these tax changes go into effect. And so we're a little concerned about where our money's at. And so we know the governor put out 3% in agency cuts, but because we're a little nervous about this, the Joint Finance Appropriations Committee said, I actually want to see what an additional 1% and 2% cuts in 26 and 27 would look like across state agencies. So it ended up equaling a 5% cut to most state agencies. And one thing I will mention, I know the Medicaid division was exempted from the additional cuts above 3%. However, there are some healthcare services that are impacted that aren't directly in the Medicaid program. So these are mental health court programs, suicide prevention services, as well as children and family mental health services at the Department of Health and Welfare. And so this brings us to what happened last Friday. I had to think about that for a minute. I can't believe it's only been just last Friday, not even a full week. So the Joint Finance Appropriations Committee, after they had asked all these state agencies to bring in their extra 1% and 2% cuts, they then voted to do a 5% cut to what's called the maintenance budgets. And so they decided on Friday to pass a lot of these state agency budgets out of the committee on Friday. And there were several legislators who really pushed back against this process. So basically what the maintenance budget is this upcoming fiscal year 2027, which starts in July of this year. They basically took what 2026 cost with the 3% cuts, or even 5% cuts on some state agencies, to Medicaid programs, to the Department of Health and Welfare. So let's just say Department of Health and Welfare as a whole. They basically set the Department of Health and Welfare budget, which included the Medicaid budget, at a maintenance level, which was last year's budget with the 3% cuts to the Medicaid program and then the 5% cut to other areas of health and welfare. And basically what they said is, this is our starting point. This is what we consider a base budget, what will just keep the lights on. There was a lot of, and this is a newer process that has never been put out into a document that is available for public viewing or even lawmaker and legislator public viewing. Basically, it's created a lot of confusion over the voting process within the Joint Finance Appropriations Committee and how the separating budgets are going to play out. So they set all these budgets last Friday, which included the Department of Health and Welfare and Medicaid. Now it is up to the working groups. So it's little groups of legislators on the Finance Committee that will get together and work out any sort of enhancements that need to come to the upcoming budget. So they're like, okay, here you passed our starting point. And now it's up to the work groups to decide, what else do we want to include for the upcoming year? They could do things such as reverse all the provider rate cuts that have happened. They can increase, they can basically take all the additional asks from the department. So population forecast increases like inflation and other needs for the program. They can add that into what's called that enhancement budget that they plan to vote on. The tentative date is set for March 6th. However, there's a lot of concern about whether or not some of these enhancement budgets actually might be taken up and voted on. Oh, I guess like maybe, you know what? I think I might have, I'll go to Medicaid budgets in a couple slides. I forgot where I put them. Sorry about that. So I guess before I'll talk specifically about the maintenance, the Medicaid budgets here in a minute. But basically where this leads us now and in the coming weeks is these working groups are going to start getting into their groups and working on those budgets specifically. And so we'll really start seeing what the committees and the budget committee is going to be doing with those. Before I jump into all the Medicaid specific dates, I want to highlight a couple important dates coming up that I think will be really telling on where the rest of this legislative session goes. So as I had mentioned, there's not been a lot of opportunities for public hearing, even though we've had a lot of bills really introduced. And I think over the next several weeks, we're going to start seeing the public hearing opportunities really ramp up in the committees. And so especially because given in the next week or so, anyway, February 23rd to the 27th, basically the last week of February, is the primary election filing period. Essentially, because Idaho is a supermajority state, a lot of legislators are going to be looking to that February 27th, and when that closes, who is going to be challenging them in the primary and who potentially might just be getting reelected this fall. And so that's a pretty significant time frame that, depending on how many people are going to have challengers, really might determine how quickly they might be wanting to get out before the end of the get out to go and campaign. Also, so March 9th is the transmittal deadline. Basically, that means that is the goal. It is not a hard rule, but it's the goal of both the House and the Senate to have their bills over to the other side. March 12th is when the Finance Committee plans to complete the rest of their budgets. So while they set the maintenance budgets, it's all those additional enhanced budgets and additional requests for the upcoming year, as well as any supplementals and adjustments they need to make to the previous year. And then March 27th is what's called the sine die target date. Sine die means to adjourn. And that is when they hope to be done with all of their business. And again, I have never seen them actually sine die on their target date, it usually goes longer than that. And so we will see if they hit their target date. And it really just depends on what happens during the primary election filing period. Okay, I'm going to jump into the Medicaid updates now and talk more specifically about the Medicaid budgets. This is what I was starting to go to and then realized I put them further down a couple of slides. So, one of the things about the Medicaid budgets, I do want to really highlight, and I want to really give a lot of credit to everybody on this call who has networks and advocates that have been tirelessly working the last 5-6 weeks on against the Medicaid cuts with the legislature. I will say that the legislature wanted to do a 5% cut to the Medicaid program, but because of engagement from providers and from advocates and legislators hearing specifically from impacted families and individuals, they really push back on including an additional 1% and 2% cut to Medicaid. And so I know sometimes it can feel kind of bleak and like we're fighting so hard and not getting a lot of wins. And so I just want to acknowledge that is a win in itself in the environment that we're currently operating in. And so because of them not including a 1% and 2% cut, essentially that means that they are including just the 3% cut for 26 and then the 3% cut for 27, which is in the maintenance budget. And so what I will mention about what is still needing to happen with Medicaid budgets, they need to pass what's called the supplemental budget and the enhancement budget. The supplemental budget is basically looking at what unpaid bills there were in 2026 for Medicaid and where some adjustments need to be made to the budget. And so they basically still need about $92 million for 2026. And I will just highlight that $92 million is before the provider cuts went into effect. So what we are advocating for is for the full supplemental budget to pass because it would reverse those 3% cuts for 2026 for the Medicaid, for Medicaid provider cuts. What the likely scenario there is 2026 might be kind of difficult to get away from those provider cuts because they already went into effect. But I think that for 2027, there's a real case to be made that those can be either removed or reduced from 2026. A lot of legislators don't really want to see those provider cuts. They feel like they're a little too high. They want to maybe look at maybe a 2% cut or maybe even just do away with them altogether and just use rainy day funds to help cover some costs until revenues balance out a little bit from all the tax changes. So there's the supplemental budget that from 2026 and the enhancement budget for 2027. And for 2027, basically, while it currently has the 3% cut included in there that was voted on last Friday, they basically can go in and say, well, in our enhancement budget, we are going to put that 3% cut back. We're going to basically not do that. And to have the enhancement budget pass, it would be about $81.7 million above what was passed the previous year. And I think there's a pathway forward for that. And a lot of legislators do want to see that happen. Let's see here. So one of the things I do really want to highlight is it was actually quite fascinating to watch the debate in the Joint Finance Appropriations Committee last Friday because there were several legislators who were really speaking out against this process, felt that it undermined the working group's process to set the budgets for the upcoming year by automatically just voting in the cuts to the maintenance budgets. And so I want to just highlight that there are several legislators who voted against the cuts that passed last Friday. And I'm highlighting them here because, one of the things I probably should have said a little earlier is I am going to have a few different action opportunities for all of you. I will upload all of the slides into the chat before I'm done today so you can have access to these slides. But I have a couple calls to action for folks. And so this is basically the first one. I want if you have the time and have the desire to do it, we're encouraging everybody to reach out to these legislators and to thank them for voting against these cuts, for standing up and telling the finance committee they did not like this process and they were not supportive of these cuts being included. So I'm just highlighting these legislators here. I think it's important that and we may not always agree with all the things the legislators do, but when they do the right thing, we need to really lift them up because a lot of times they just mainly get a lot of criticism. And so we need to lift them up and thank them when they do the right thing. So I encourage you to send a quick email to these legislators and just say thank you for voting against the cuts in the budget committee last week. Okay, so here are the next steps for the Medicaid budgets that I will just highlight. So the Joint Finance Appropriations Committee needs to pass the Medicaid supplemental and the enhancement budget. This is the next call to action. So what we are asking folks to do is, because we are really hearing that some lawmakers within the budget committee are hesitant to pass any additional Medicaid budgets. They essentially could look at the maintenance budget and say, well, we funded Medicaid, we funded the Department of Health and Welfare, and so we're good. We can go home. I don't need to vote on these. And so when these come up for a vote, they could technically vote these budgets down. And there's talk of doing that. So here's one of the biggest asks that I will have today for everybody is, if you have a lawmaker on the budget committee, reach out to them and ask them to pass the supplemental and enhancement budgets, to ask them to be supportive of those budgets. That Idaho Medicaid and Idaho cannot sustain that big of a cut to the Medicaid program. And one of the things we hear quite often is, well, how do we going to pay for this amount? You know, we're struggling with reserves. We have all this uncertainty. And a lot of legislators who are against these cuts are talking about how we should be using some of our reserve funds or our rainy day funds. We have about $1.7 billion in reserve funds right now. And there is talk about using some of those to help protect some of the most critical programs, including the Medicaid program, until some of the revenues level out and we can really get a good sense of what's happening in our revenues from all the tax changes. So one of our recommendations is we'll use some of the rainy day funds. It's just, we can't afford to have this massive of a cut to Medicaid because it is tens of millions of dollars in cuts to Medicaid. And then if you don't have a JFAC legislator, we're asking you to contact your legislator and the one that's in your district, largely because they're really seeming to respond to constituents in their districts right now, and they're feeling the pressure from their constituents. And so we are finding that if you contact your legislator who isn't on the finance committee, let them know what you're hearing about how, hey, I'm hearing JFAC might not pass these, and I'm really concerned about that. Will you please be supportive of these budgets? And will you share with your budget committee colleagues that you urge them to support it as well? So it's not only just them getting it from their constituents, but then if they can get a little pressure from their other friends in the legislature, it will give them a little bit more pressure to actually pass these supplemental and enhancement budgets. Here is the list of the Joint Finance Appropriations Committee and their districts, if you happen to know your district. You can also, I will just say, like, you can visit legislature.idaho.gov to access, to find who your legislator is. There's a little button on top and it says, who's my legislator? And you can find your legislator that way. I think we actually even have a slide on how to do that a little bit later. Oh, it's right here. See, this is just the point I'm at in the session. I put this all together and forgot where I put all my slides. And I put them together yesterday. So here you go. Legislature.idaho.gov, and up in the little right-hand corner, it says, who's my legislator? You click that and you can enter your address and it will tell you who your legislator is. And you can even click on each individual legislator and it'll tell you what committee they're on. So you can see if they're on Joint Finance Appropriations Committee. Okay, so we talked a lot about budgets, talked a lot about what's happening in Joint Finance Appropriations Committee. So let's shift gears to the House and Senate Health and Welfare and where those discussions are happening right now when it comes to Medicaid cuts, Medicaid changes. So one of the things that's important to note is that the Joint Finance Appropriations Committee, they set the budget. They a lot of times will include intent language, but generally they try not to do anything in intent language that is policy because then it has to be reauthorized year after year. Those lines get a little bit blurred sometimes, but if they want to make significant cuts to the Medicaid program by eliminating services or changing some of those, the way that that functions, that would have to go through a policy bill within the committees. And so while JFAC can set the budget, it's the committees, the germane committees that set the policy. And so the one of the things that the Senate and House Health and Welfare committees are tasked with is having a discussion about what they want to see within budgets and the Department of Health and Welfare budget. And then they come to JFAC and they tell the chairs will say, here are the recommendations of what we think you should do with the budget based on what my committee members are saying. They had about 2 weeks ago, a couple weeks ago, they had a committee discussion about what different legislators would like to see within those recommendations. And while that isn't necessarily the list of recommendations and what the committee is putting forward is not public information at this moment, here are just where some of the discussions are heading and what a lot of people are looking at. And I think that based on these discussions, it could key us into potential legislation that we could see come down the road, if not here in the near future. So some of the things that some legislators were looking at is like, what are some ways we can increase efficiencies? Are there some different consolidations we can look at instead of eliminating services? And so there was a lot of discussion about, hey, maybe we could streamline some processes a little bit. The thing about that is that would take longer than just this legislative session and wouldn't necessarily be like an immediate savings to the Department of Health and Welfare or Medicaid. It would be, let's look at the long term, how we can explore some of these options. There was discussion around changes to residential habilitation, supported living, because of some of the funding mechanisms that is happening with different folks in that program, and thought there was some wiggle room there with some of that funding. There was, of course, we always see this, always comes from a few, but Medicaid expansion, of course, came up, and there was discussions around, well, what if we looked at Medicaid expansion repeal? What if we could save money there? We could save money. Looking at ways to limit who can access the program. So there was some discussion of that, but I would like to say that one thing that I was happy to see is it did not dominate the conversation within the committee. It was pretty common that a lot of legislators didn't necessarily want to see cuts that were just going to increase costs in other places. And so this is where I just really credit a lot of advocates and providers who are having conversations with committee members. They're starting to get it. They're starting to understand that Medicaid is pretty bare bones and that there's just not a lot of opportunity to make cuts without increasing costs other places or creating harm. And so I think that at this point, that's why we really haven't seen those policy bills come out quite yet, is because there's not a lot of consensus. There were, when you look at 16 members on the House Health and Welfare Committee, they all have different opinions about how to achieve savings. And when you have that many people, they're having a hard time coming to a consensus on any sort of policy bill that might actually make it out. Still early though, so I'm not holding my breath. It's just this is where the discussions are currently at within at least the House Health and Welfare Committee. So I guess I'll just one of the things I'll just reiterate: cuts to services like eliminating complete services, directing the department to completely eliminate different programs, that's a policy bill, as well as Medicaid expansion repeal. That would have to come in the form of a policy bill. Things like reducing provider payments, that can be done in intent language through the finance committee. Requesting to do some evaluations or audits around efficiency opportunities. That can be done in intent language. And so that's basically what we're looking for, is what is some of the intent language that is getting put into Medicaid budgets coming up? What are some of the policy bills that would do bigger cuts to the programs? So here's basically the next steps for the health and welfare committees, both on the House and the Senate. They both have to go before the budget committee to submit their recommendations for the program. And then if they come forward with recommendations for cuts to anything, then it's basically up to them to introduce any of those policy bills that would eliminate any of those services. And so here is another ask of everybody, another opportunity for taking action is continuing, if you have already, or reach out and contact your health and welfare legislator and ask them to reject legislation that would cut Medicaid services or expansion. I believe the chairs are going before JFAC towards the end of next week. And so over the next week, it'll be really telling on what type of policies are going to start coming out in the next, well, probably the next couple of weeks, really. And so engaging them right now is a good opportunity. Here are the House and Senate Health and Welfare Committees, so you can see what districts they are. But again, you can visit the website and see who's your legislator, see what committees they sit on, and make that personal phone call. Reach out to them, connect to them. I know several of these legislators who they will answer their phone and talk to constituents. And so you can try their office number. You can also try their other number. A lot of them, it's their cell phone number. So sometimes it'll say session only. You can try their office number, and then you can try that other number on there. It's public information, and a lot of them will answer that phone or return your phone call. So just to recap, when we're having conversations with legislators, what we're encouraging all of you, here are our top recommendations. We want the legislature to fully fund Medicaid supplementals in the enhancement budgets and use the rainy day funds if necessary. We want them to preserve Medicaid expansion and reject cuts to Medicaid services. And then we want them to reverse the 4% Medicaid provider payment cuts. So we want to see, at least even in the upcoming year, that those are not made permanent in the upcoming fiscal year. I'll just real briefly highlight the legislation tracker. It's what we call our legislation tracker. These are ones we're keeping an eye on, but not necessarily taking a position on, just tracking for purposes. The Rural Health Transformation Program, which was that big funding package passed with OB3 or HR1 that gave the Idaho about 1.86 million a year to work towards rural health programs. So this bill basically just puts together a committee that gives a legislative committee to give oversight to the program and give the authority for the funding mechanism. We have a few concerns about a legislative oversight committee being in charge of everything constantly. It could bog down the process and the use of those funds. So it's something that we're tracking. Senate Bill 1267, this actually didn't make it out of the Senate committee. It was Medicaid for Workers with Disabilities. House Bill 574, Medical Freedom Act changes. It's basically a medical mandate or an anti-medical mandate bill. This bill basically would require businesses, daycare centers, schools to never be able to ask for medical documentation. It also makes the IRIS immunization system an opt-in instead of an opt-out. And I won't go into too much detail about this one because I don't, from what I'm hearing, it's probably not even going to get a hearing this year. And so we are tracking it, just keeping an eye on it. But as of right now, I don't think it's going to even get a hearing. And then the last one is House Bill 592, which is a hospital reporting of immigrant patients. So it's basically a data collection trying to track who is an immigrant, whether here lawfully or unlawfully. And this is another one that we're keeping an eye on, but not really sure where that one's going at. We haven't seen it have a hearing, but it could increase costs for hospitals and reduce access to care. And so we are tracking that one as well. I just want to also, I know I had covered a lot of the actions and what the asks are, but I just want to remind everybody we have talking points available on our website that really come from a standpoint of how cuts to healthcare is detrimental to all Idahoans. And so you can use the QR code. You can also visit our website, idahosupportsmedicaid.com, and go to resources to access our talking points. And now I will go through opportunities for action, and then I'll start taking some questions. So again, we have our general action alert where you can use this email action tool if you want to just send a quick and easy email. You can use our action tool to do that. And we have talking points on there and directions how to do so. It's on our website under Take Action, or you can use this QR code. We are actively looking for stories. As always, we help people know how to engage with the legislature, how to share their story. We really work to help people maximize sharing their story in ways that's really impactful. So if you have somebody or you want to share your story or get more involved, please reach out to us. Just also a reminder, we have an advocacy toolkit. We're going to start getting into a lot more hearing opportunities in the coming weeks. And whether you're testifying on Medicaid issues or even your own issues, we have this great advocacy toolkit, and it really just gives you tips for talking to lawmakers, the media. It also walks you through how to register to testify, how to testify in person, how to craft a 2-minute testimony and 2-minute message. And then we have our general just Medicaid and Idaho fact sheet with some Medicaid expansion talking points. Also just flagging for everybody, the Medicaid managed care listening sessions are still going. They're having them about every month through May. And the next one coming up is March 10th in Gooding. You can also visit the website, healthandwelfare.idaho.gov /managed care to get more information. And then, as always, if you're not subscribed, which I'm assuming most people are at this point who are on this call, please sign up for our network newsletters to receive updates. And then also, we are across all social media platforms at this point. We're on Facebook, Instagram, and we actually just started expanding onto TikTok. So please follow us and share our posts. And now I've noticed a few questions coming through. And so I am going to start, I'll go through the chat and then I'll work my way over to so one of the things, okay, so there was a question about getting a link to download this recording. So to the person who had reached out and asked that, if you want to email me, which I can send you the recording, I will also put in the chat here the presentation so you can have access to the slides. There was a question about self-direct waiver certified family home program. So right now I will just say certified family homes were exempt from some of those cuts. There has not been any proposals at the legislature to change that specific program or change those funding streams. So certified family homes were exempt from the 4% cut. One of the other questions was about advocates feeling frustrated about transparency. And legislators not having a lot of answers. And I think, so I guess just when it comes to transparency with legislators, and one of the things I will say, I think there's been a lot of efforts over the years from a lot of legislators to increase transparency, but then there's other areas where I think there's still a lot of opportunity for growth. And so one of those areas is the Joint Finance Appropriations Committee has had a lot of changes over the last several years on their process, and nothing has really been written down in a way that was transparent and a way for legislators and the public to even understand what's happening. I do know that advocates are frustrated, legislators are frustrated. And so I think that there is some opportunities for increases in transparency. I think also another thing that's really hard is the fact that the Joint Finance Appropriations Committee, they don't do public testimony. They don't take public hold public hearings on the budgets that they're doing. And so that also is frustrating. And then also the Medicaid working groups, they work behind closed doors. So nobody really has an understanding of what they're doing and what they're putting into those budgets. So there's definitely some opportunity for growth in being more transparent. And I share those sentiments about frustration and feeling like there is a need for increased transparency. There was a question about Medicaid reimbursement rates getting cut 4%, even though the governor only told state agencies do 3%. That's a great question. And so last fall, when the governor had told state agencies to hold 3% cuts across the board, Department of Health and Welfare did an evaluation of all the different services to see where they could do those reductions of 3%. What they found out is they actually had to go to the Center for Medicaid and Medicare Services to talk about, to see where they actually could make those reductions, because there are federal rules that require certain provider rates. And so they came back and found that there were several services that they could not make reductions to. And then there were some services that have had increases in their provider rates over the last couple of years to address particularly home and community-based services that they felt would be detrimental to the services if they did a rate cut to those services. So what they found was they needed to exempt several services. And another piece to this too, they held a public comment period where they got over 3,000 comments that basically shared their concerns about very specific services. And because of those comments, they exempted several different services. Certified family homes was one of them. Tribal clinics, for example, was a federal requirement. Some peer support services, as well as and that might not even be the correct term, but basically some in-home health services were exempt for home and community-based services, as well as school-based services. And I don't have the whole list in front of me, but because they had to exempt some services, they had to do a 4% cut to others to make up for the services they couldn't do reductions to. Okay. Then there was a question about DDA centers and where they fit into these cuts. I think one of the things I'll just mention is like as far as this goes, pretty much what has only gone into place is the 4% provider cut. There haven't been any other bills yet that are doing any additional cuts. And so basically right now, those are the only cuts that have been put into place. I'm not sure where the working group is going to come out of here. I haven't heard any legislation around specific things around centers. There is some exploration of potentially reducing some provider rates around residential habilitation, or just changing some of the rules around that. But as far as actual legislation, I just don't think there's a lot of consensus yet on any additional cuts beyond the provider rate cuts, but they could come. There was a question about cuts to OT, occupational therapy, physical therapy, and speech therapy that be appreciated. Okay, so the pre-authorization for 20 visits. Okay, so just for clarification, the 20 visits, this was decided on by the legislatures. Sorry, not the legislature, Department of Health and Welfare at the instruction of the governor's office. Basically, what they did was, as part of their budget cuts or reductions, they didn't want to actually eliminate those services. It would take the legislature eliminating those services. But what they did instead is they put a cap on them for 20. And so basically, and it's 20 visits per OT, 20 for physical therapy, 20 for speech therapy. That basically said, if you hit your 20 visits, you have to get authorization to show it's medically necessary to continue those. That was another way for them to try to rein in costs. So basically what that is something that the Department of Health and Welfare had the authority to move forward with. It would take the legislature giving them direct instructions to not do that anymore, or basically revert it back to the way it was. And so I would just anticipate, unless the department is told otherwise by the governor or the legislature, that is going to be the current practice moving forward. And then there was a question about how music therapy services are impacted. That is something I can't specifically speak to. I think that if I haven't seen anything specific to music therapy outside of probably just seeing a reduction in the provider rates, but we'll keep an eye out on that. I haven't heard anything specific about music therapy. Okay. It looks like I have maybe a couple more questions. Oh, nope, I think I got all those. Okay. Let's see. How can we change rules, specifically assessment done with Liberty? Why is it necessary? Okay. So, I think there's some questions in here about how we can change the rules around assessments that is done with Liberty, which is the contractor that works to assess people's services who have disabilities, and why it's necessary to do every year. So that is a great question. I think that's something that is much more at the legislative level to look at some of those opportunities to reduce costs and do some efficiencies. I think that if you get into the weeds with very specific legislators, there might be some opportunity there. But I will just say that there are opportunities. However, some legislators like people having to go through the renewal process, so they make sure that they still qualify. So while I say there's opportunities for efficiencies, there's also some challenges within that as well. And then I guess maybe a point of clarification, there was a question about what the bill number is for the 4% provider cut. So that is not something that actually has to be done through legislation. That can be done through the budgeting process. And so the 4% provider cut that happened by the governor, basically the Joint Finance Appropriations Committee just has to approve that when they pass their Medicaid budgets in the coming weeks. And so it's just whether or not the legislature, when they pass a supplemental, if they are going to include that provider cut or if they are not. And so when they vote on March 6th, that's their anticipated voting date. That is something that they may look at removing, not including for the upcoming fiscal year, or that they would potentially include it. So it would be included in that budget, which when it passes, that gets a bill number, and that would be more specific to the whole Medicaid budget, not just the provider cut. All right. You guys have lots of good questions today. Okay, I'm going to stop sharing because I want to upload really quickly the slides for today so you can have access to that. And if anybody has any questions, feel free to keep typing those. Okay, looks like it's uploading. It just might take a second. So if you don't get it and you need it from the webinar, please feel free to reach out to me. Again, here is my email if anybody has questions. And stop